Shocking military reports are now shedding light on the conditions at some long-term care homes in Ontario and Quebec. Residents in long-term care homes, which in Canada are a mix of privately and publicly owned facilities managed at the provincial level, make up about 80% of the total COVID-19 related deaths in Canada. With more this morning, we're joined by Carol Estabrook. She's a researcher at the University of Alberta and a Canada Research Chair in Knowledge Translation. Thanks for joining us this morning.
Good morning.
So we have now had a chance to see two reports by the Canadian military on the conditions in our long-term care facilities. Boy, both of them really hard to read. In Ontario, they highlighted issues with allegations of inadequate or inappropriate frontline care. In Quebec, the allegations were more of an administrative nature, issues that dealt with management, staffing, and access to equipment. Are all of these indicative of the larger systemic problems in our homes?
Absolutely. This is a problem, as we've heard over and over, that's been going on for decades. COVID isn't the cause of it. COVID just is the most recent and global shock that we've had to a system that's been under duress for a very long time.
Well, Federal Health Minister Patty Hajdu has said Ottawa should look into developing a national standard for long-term care. And to what degree would national oversight help, given that they're managed provincially?
Well, one of the things I think we should remember is that we don't need, this is a solvable problem. So we can solve this problem with a federal framework, something analogous to the Canada Health Act. I don't think the Canada Health Act is quite the solution because it's focused exclusively on health, as well as respect and augment provincial jurisdictional rights and activities and concerns. So I think we should not squabble here. I think this is a call for action, and if we work cooperatively, we can create a solution that will be good for all of Canada and hopefully stop these endless shocks to the system that really reflect the system that's desperately in need of redesign.
Carol, I like what you said, that it's a fixable problem. So I guess people in Canada are wondering, what's the fix and how fast can we make it? Because as both reports outlined, these conditions weren't just because of COVID-19. Some of these have been in existence for decades.
Absolutely. We can't fix it all at once. It's a big, complex problem, but we can immediately fix issues or begin to fix issues related to the labor force. That's the paid workforce and the unpaid workforce that work in nursing homes and in the areas that support nursing homes. So we need to look at supports for unpaid family caregivers. We need to look at, immediately, we have to look at the educational standards, the salary levels, the benefit levels, and the continuing education requirements for that very important front line. And what do we need among our regulated staff, our nurses and physiotherapy therapists and physicians to support that frontline staff?
So bottom line, it's not just about penalties or more inspections. It's actually going to take some money to fix the system.
Of course it will, but it doesn't need to break the country. It is going to cost some money, and we have some choices to make about how we want to look after our grandparents and parents, the people, as you've heard, even the Prime Minister say, the people who built this country. What do we want to be known for? You know, Hubert Humphrey said years ago that the moral fabric of a country would be measured by how it looked after its weakest and most vulnerable, the young and the very old.
Carol Estabrook, I want to thank you for joining us this morning from Alberta.
You're welcome.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.